Stop pretending that all the experts agree about masks and social distancing. What you really mean is that all the people allowed on TV agree with these solutions. There are countless doctors, virologists, and epidemiologists who have been speaking out about these draconian measures for months. If you don't already know that, it just proves that you don't know what's going on. You are not a hero that's saving lives. You're simply virtue signaling that you do exactly what your TV tells you to do, and that's nothing to brag about. If I stay inside for months and avoid vitamin D, wash my hands like an OCD clean freak and destroy my microbiome, live in fear and high stress and deplete my immune system further, cover my breathing orifices with a mass-produced mask made under goodness knows what conditions, order a toxic McDonald's from my car, and destroy my gut. When I do finally go back outside properly and my lymphatic system goes nuts flushing toxins out, I'll blame all the normal and healthy people for my sickness. They did COVID tests on a watermelon, a goat, and a sample of wastewater collected in Barcelona on March 12, 2019, and they all tested positive. When are you going to understand that tests are a sham and therefore the statistics are a lie? Do you know what an asymptomatic carrier is? A healthy person. Immune systems are developed by exposure to antigens, viruses, and bacteria. This is by Dr. Daniel Erickson, emergency medicine specialist. Andrew W. Saul, www.dryourself.com. N95, general public. The Centers for Disease Control and Prevention, CDC, does not recommend that the general public wear N95 respirator masks to protect themselves from respiratory diseases, including coronavirus COVID-19. N95 masks are designed for contaminated environments. That means when you exhale through N95, the design is that you are exhaling into contamination. The exhale from the N95 and other masks are vented to breathe straight out without filtration. They don't filter the air on the way out. COVID breath is unfiltered being exhaled. Because it was designed for contaminated environment, it's not filtering your air on the way out. Surgical mask. These masks were designed and approved for sterile environments. The amount of particles and contaminants in the outside and indoor environment where people are clogging these masks quickly. The moisture from your breath combined with the clogged mask will render it useless. If you come into contact with COVID, your mask traps it. You become a walking virus dispenser. Every time you put your mask on, you are breathing the germs from everywhere you went. They should be changed or thrown away every 20 to 30 minutes in a non-sterile environment. Surgical masks are not designed for the outside world and will not filter the air upon inhaling through it. Its filtration works on the exhale, rendering it useless outside a sterile area. Cloth mask. Do not filter anything. As you exhale, you are ridding your lungs of contaminants and carbon dioxide. Cloth masks trap this carbon dioxide the best. It actually risks your health rather than protect it. The moisture caught in these masks will become mildew-ridden in 30 minutes. Dry coughing, enhanced allergies, sore throat are all symptoms of micromold in your mask. The daily death count has morphed into the daily new case count, as 100,000 tests a day have exploded into 700,000 tests. Is it a wonder cases are increasing? But what they don't dare mention is that deaths and even the death rate continue to decline. In fact, the CDC warns that COVID is at the stage where it cannot even be classified as an epidemic due to declining deaths. Still, more masks are required, and petty dictators all around are calling for a return to lockdown. Can the truth ever be heard above all the lies? Ron Paul. From Caitlin, a registered nurse. Them. But Kate, don't you wear a mask when you're in the operating room? You of all people should be advocating for people to wear masks. Me. I'm so glad you asked. Let's break down a few key points. 1. In the surgery setting, we wear masks for a couple reasons, none of which have much of anything to do with preventing the spread of viruses. The first is to prevent bacteria particles from our own nose and mouth from entering into the patient's surgical cavity. This is not because anyone is sick. This is because we all carry pathogenic material in our airways that normally are a non-issue. But when a patient is in a compromised state from being given general anesthesia and having their body sliced open, they become more susceptible to these opportunistic microbes we all carry. The second purpose of the mask in surgery is to prevent exposure of the provider to the patient's fluids and tissue. Interesting to note, in many countries the circulating nurse doesn't wear a mask. Only those hovering over the surgical site don PPE. Secondly, not all masks are created equal, and most people have no idea which masks are for which circumstances, or that most masks provide little, if any, protection against viruses. The right mask worn incorrectly increases risk. The masks typically worn in the operating room are simply medical-grade surgical masks, like the one I'm wearing here, picture shown, and are not recommended for use when the presence of small particulate or aerosolized pathogens are in play. They're great for keeping the team spit out of the patient's incision while they communicate during surgery and prevent chunks of tissue and blood spatter from being on the inadvertent lunch menu. But aside from that, they're really just little humid breath collectors. Instances when one would don an N95 respirator would be things like a case with a TB positive patient. And we are fit tested for those and given a specific mask type to use in such cases. The fit test consists of putting a giant plastic box over your head and spraying an aerosolized compound into the container while you wait to determine if your mask fit is good based on whether you can taste or smell the spray. It's a big ordeal and redone each year in most facilities. Last, in my 15 plus years in healthcare, I have witnessed more improper use of PPE than I can quantify. I have seen seasoned medical professionals contaminate themselves and everything around them in a matter of seconds. Using equipment without the proper knowledge or training is a recipe for disaster, and in this case, increased exposure. Unless you've thoroughly read through the literature and understand the approved uses, application and removal process, appropriate discarding protocols, etc., you should probably just sit down and stop promoting inappropriate and unsafe mask use. So if you're not planning on doing some surgery while you shop for groceries or take a walk in the park, your mask is really just serving to warm your face and harbor some of those germs you're so terrified of right in front of your airway. And if you're wearing a sock or underwear on your face or rocking a bandana like we're in the Wild West, you're simply creating more laundry for yourself, but doing absolutely nothing to stop the spread of pathogens. And I have to say, I'm a little disappointed to see so many educated medical professionals promoting unsafe, baseless practices and seemingly forgetting their foundational knowledge. None of this even touches on the negative health impacts that can be caused from extended mask use, chronic fear and anxiety, and allowing others to make decisions for you because you don't feel informed or empowered enough to make them yourself. Today I sent a pulse oximeter to work with a 23-year-old man who works in an open kitchen over a grill. Before shift, 99% oxygen level, 3.5 hours of wearing a mask, 93% oxygen level, 7 hours of wearing a mask, feeling dizzy, 88% oxygen level. How does this support the assertion that masks are completely safe? Send in the Lionhearted.